feel like some of your relationships have changed since your weight loss surgery and not necessarily for the better? Is this change in relationships common? Why does surgery affect these changes? Well, don't go anywhere because bariatric psychologist Dr. Connie joins me to explain why relationships change after surgery and how to handle these changes.
They're back. Calcium Dark Chocolate Bars, a ProCare Health customer favorite. Now available online at procarenow.com. Creamy chocolate plus calcium and vitamin D. You'll love them too. Use code SUSAN10 to save 10%.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 134. Tired of all the hype and confusion when it comes to nutrition, especially bariatric nutrition? Eat this food. No, don't eat that food. Skip certain meals. Try this diet to reset your pouch. Or heck, just do a detox. It's enough to make you say, forget about it. I don't know what to do. Well, I do. I know what to do. It matters where you get your nutrition information. When it comes to your bariatric surgery, nutrition's specific. So let's cut through the hype. Let's get that accurate nutrition information you need to know. I created Bariatric Surgery Success just for you. You're in the right place. I'm glad you're listening, and I appreciate you and your time. I want to give a shout out today to Tracy, who said, wow, so many golden nuggets in your podcast. I started at the beginning and I am implementing so many good things in my daily nutrition plan. Thank you. Well, thank you, Tracy. I'm so happy you found those golden nuggets and impressively have implemented them into your daily lifestyle. Well, speaking of golden nuggets, in 2 weeks, I'll be talking about turmeric and whether it has anti-inflammatory benefits. We'll talk about turmeric both as a spice and as a supplement. Well, joining me in the studio, it's a good day, is Atlanta-based psychologist Dr. Connie Stapleton. And you know, if you're a regular listener, Connie always brings her A game every visit. She shares her vast experience in the mental health aspect of bariatrics. She doesn't hold back either, right? She gets to the core of the issues, and she always shares practical ways for you to improve your relationships with food, with other people, and most importantly, with yourself. And today, she's doing that specifically with all your questions on relationships. Well, you can find links to Dr. Connie's website, as well as her podcast called Bari Aftercare in the show notes. Bari Aftercare, great podcast. I've had the opportunity to be on it before, and we'll be doing that again coming up. Well, hey, Dr. Connie.
Hi, Susan. How are you this morning? It's good to be here. I love it when we get to chat together.
Oh, I do too. It's always so fun and such good information. You know, I'm thinking about information. I'm remembering that you just had a new book and journal both out recently. So remind us about that, especially for our newer listeners that might not know about them.
You are correct. The newest book is called Mind Prep, the book. How to prepare for weight loss surgery and to live as a healthy post-op. And I tell you what, this book is a lot thicker than I thought it was going to be because it has so much information. So it doesn't matter where you are in this journey. This book is incredibly helpful.
And it's on Amazon, right?
It is on Amazon. And I also just put a Bari Aftercare daily progress journal to kind of help you stay on track with, when you were on Bari Aftercare, the podcast, you talked about the process that a person can follow if they want to keep this weight off and live that healthier lifestyle ongoing. And that process is what this book is about.
Oh, that's terrific. And I'll be sure and put the links in the show notes. So if anyone wants to have a link directly to it, they can do that, or you can go to Amazon and just search for it. Well, there's been a lot of conversation in my Facebook group about relationships with members of the group, especially asking about marriages and how they change after surgery. Is it true that a lot of married couples divorce after one of them has bariatric surgery? That's been a really common question.
It is, and it's interesting. Many marriages improve, and many people stay the same. However, the divorce rate post surgery is higher. In fact, it's up there around 70%.
What?
So
70%, 70%.
70.
Well, that's
Yeah,
even higher than the
pretty,
national average, right? Of about
it is,
50 or
yes.
50 something
Yes.
percent.
Yes, and that's the downfall right there, right? But things are either going to get better, and a lot of times they do. So don't lose heart.
Yeah,
But do
absolutely
know,
not. We'll find out what to do about that.
right? But do know there is a high rate of divorce post surgery.
And in relationships that maybe are not marriages, but they've been long-term relationships or even friends, relationships and friendships, and we'll get into that more in a minute. Do you see the same changes? Some relationships also ending for a number of reasons and others becoming stronger?
It's very common, and it's interesting because people often don't anticipate this as an outcome of having weight loss surgery or losing weight. And so I think a lot of people are taken off guard by the changes in their relationships after surgery.
So I'm hearing what you say about surgery and this percentage of 70 something percent of people, the divorce is higher after surgery. But in your practice, what you see day to day, do you see the same thing to be true? Or what do you see more of? Successful relationships, rebuilding, getting better? What do you tend to see more of?
I actually see the whole gamut. I do hear about a tremendous number of divorces. And I think if a relationship is pretty darn strong going in, it's going to remain strong or get stronger. But if it's on shaky ground going in, it oftentimes gets shakier.
Okay, so let's talk about specifics. Let's look at some of the reasons for, I'm going to say, increases in new relationships or even new marriages or your first marriage, whatever, after you've had surgery. Let's talk about that side.
Yeah, that's also interesting because what researchers show is that people who've never been married before post-surgery are more likely to get married, or yes, are more likely to get into a committed relationship or get married than people who have not been married. And comparatively, there are more relationships that start after surgery as well.
So what do you think is going on following surgery? So there's been significant weight loss. We know this. And then with that, I always am looking at those non-scale victories, how so many other things change. So from a mental health aspect, I'm thinking about quality of life, social life, things like this. What do you see that people experience after mental health wise, after a significant weight loss?
So mental health wise, it can appear, now this can be a false sort of facade, or it can be a genuine thing that's happening within a person, because people become oftentimes they appear to be more confident. They start taking better care of themselves. They learn to set limits with other people. And confidence is a very attractive trait,
It's
right?
powerful, right? I think confidence,
It
self-confidence is powerful.
it is. And it's also been described as being very sexy. So it does attract people to you. Now, here's the deal. There are some people who develop a genuine confidence and employ it in a healthy way, and those people develop healthier relationships. There are some people where there's really an internal low self-confidence, and there's this appearance of what seems to be a confidence, but it's not genuine. And so sometimes those people, and it's hard to tell the difference because it might look the same. They're more involved socially, they get out and do more things. But the healthy people, emotionally and mentally, are bringing their people with them. They're including their families, they're including their significant others. They're saying, let's grow together and get out there and do things together. Other people are like, wow, I am making up for lost time. And they get out there and they get a little bit wild. And the people who've been with them for the last couple of years or many years are left by the wayside.
Oh, interesting.
Those don't, yeah.
And that doesn't bode well. But I'm thinking
No.
about too, you have this increased quality of life across the board after this surgery, which to me would bring about positive changes in your social life, which part of that then is that more romantic interest from others?
Absolutely, there's more romantic interest from others. And depending again on your sense of well being internally and your sense of groundedness, you will deal with that in a healthy way, or you could deal with that in an unhealthy way. If you've never felt like you've been attractive to people before, and all of a sudden you're getting all of this attention, it can be like a kid in a candy store for the first time. And it can lead to some dangerous things, especially if you're already in a marriage.
Interesting. Wow. I'm thinking of a question that was asked in the group, and I want to know what the studies and what you have seen about this. But I think we too often focus just on the weight. So I'm always wanting to really look at those non-scale victories. But I've heard you talk before. It's not necessarily weight loss that's tied to whether someone gets in a relationship or gets married, but it's more about physical health. Is this correct? I want to hear about this because I think this is a big deal.
Absolutely. It's more about physical and mental health, right? If you're overweight, you're not feeling your best, you're not putting your best person out there. You're not being who you might be otherwise, because when we're hurting physically, we're inwardly focused, right? It's like, oh, this hurts and that hurts, and you don't have a lot to give. Whereas when you start to feel better physically and you start to appreciate the other characteristics you have besides your physical health and your interests and your personality come shining forward, it is attractive to other people, and you feel better about yourself, which is attractive to other people.
I really like this because it puts the focus on non-scale victories for the surgery over just a number on the scale. And I think that is so important to look at the many benefits that come out of the surgery.
I'm 1,000% with you on that. To me, the scale, yeah, it's nice, whatever. It's going to go down after you have the surgery. But that pales in comparison to the opportunities you have as a human being to do the things you've always been interested in, to cultivate the kinds of relationships that you've wanted to have, to enjoy life so much more fully, completely outweighs whatever that number on the scale has to say.
I agree. And it gives you the opportunity to deal with and face some of the issues that might be holding you back. And that's one of the reasons I love that you join us and really talk about this aspect. Because as big a believer as I am in food and a healthy lifestyle and eating delicious food, the food and the mental health aspect do go hand in hand and making this journey successful. And
it's so true. People want to separate the mind and the body, and it's an impossibility.
Yeah. I totally,
You just can't.
No, they are totally together on this. I believe that. I want you to dig a little deeper into divorces here because I'm going back to a lot of the questions. This is why. Why are the divorces happening after surgery? Talk about some of the biggest reasons that you help people deal with. What you see in the research, but then what rings true in day-to-day practice.
I'll tell you the first thing that comes to my mind that I hear and it hurts my heart a lot is people say they're in the marriage that they're in because they didn't think anybody else would want them. And that is sad on both counts because it's like, A, the person didn't feel very valuable, and B, almost like they've also been taking for granted or taking advantage of or using their partner.
Interesting. So where do you go from there?
You say, okay, let's dig in and look at the whole ugly truth of this and help people recognize that their self-worth led them to believe. And sometimes it's in an unhealthy, abusive relationship, so they put up with things for a long time. And now that they feel better about themselves, they're like, you know what? I have more worth. I have more value. And I didn't see that in myself when I was carrying around that extra weight. So in that example, it's a really healthy thing to do to get out of an abusive kind of relationship. But in the other situation, it's a hard thing to do, to look at, I stayed here for security, even though I didn't feel that strongly about my partner either. It was kind of a use.
Where do boundaries come into play here?
Well, boundaries are critical in relationships, because if you don't feel good about yourself to begin with inwardly, it's very difficult to say, it's not okay for you to talk to me that way. It's not okay for you to treat me that way. I'm not feeling like I have any value to you in this relationship. And as people lose weight, sometimes they develop that, wait a minute, why have I been putting up with this? I deserve more. And so
Right.
they start to recognize their value. And then the other person, if they've been taking that person for granted or been abusive, they don't like that change. And so that can lead to a split. And that's oftentimes a healthy thing.
Yeah, especially if somebody has been, just facing abuse or criticism or both
Right.
continually. And all of a sudden they're like, wait a minute, I'm not doing this
Right.
anymore. So as hard things, good things can come out of this, what role does jealousy play?
Well, here's the thing about jealousy. And I often caution people to be wary of using the words, they're just jealous. They're just jealous. There may be some truth to that, like in friendships, and friendships kind of split apart. But the go-to is they're just jealous. And I don't think we have the right to make that determination. And oftentimes it's deeper than they're just jealous. Maybe your friends now are feeling insecure. Maybe it's insecurity about their own body image, or you played the role of the heavy person in the relationship. But it could be an insecurity about, now you're not going to want to spend time with me. So caution yourself against trying to mind read and lumping everything into they're just jealous bag, and spend some time with that friend and say, things seem to be changing with us. Maybe, I value you. Let's explore what's going on.
An open and honest conversation.
Right.
Yeah.
Right.
Can be very beneficial. I'm glad you shared that. It really seems to me that this issue of relationships needs to be addressed before surgery. And hopefully it is. I don't know that. What can the bariatric team do to help patients understand how surgery might affect the relationships before the surgery, so that they can do everything they can to make sure it doesn't?
I think if everybody would at least mention this as a possibility in whatever role they play in the person's life, and say, listen, a lot more is going to change in your life about than just your weight and your body. So in this process, make sure you explore, a bariatric coach or a therapist, or come to the support group meetings where we talk more about those things, because it might not be their lane to get into it with. But if there's at least some discussion about other things in your life are going to change, and just a preparation for that. And that's why the Mind Prep book is so, so, so good, because what I try to do in Mind Prep and my book Eat It Up is to help people recognize these things are going to happen. When people are going into weight loss surgery, they want that weight off. They don't care too much about that. They don't want to hear too much about that. And I get it. But having some at least initial exposure to the possibility of these things happening is wise.
I think it's really wise, because yes, the surgery is about surgery to lose weight. But when you do, as we just said, life changes in so many ways for yourself, your health, everything. But then it starts to change in terms of relationships and work and all the things that you can and cannot do. So you mentioned to me a term I want you to talk about in bariatric surgery called a joint journey. What is it, first of all, and why is it so important to have a joint journey in order to be successful with the weight loss and the maintenance and also healthy relationships?
Oh, thank you for bringing this up. I treasure you. Because if you're in a family or in a committed relationship or you're good friendships of a long time, you have been on a joint journey with these people, and people want to be part of your journey afterwards. And so the disease of obesity is a chronic disease, and it affects more than an individual. It affects your relationships prior to surgery. And the people who have been part of your life want to be included in the ongoing part of your life. So if you're in a marriage, your weight affects your marriage before surgery, and it affects your marriage after surgery, or your partnership, or your committed relationships. And keeping that person a critical part of the ongoing journey will ensure a healthier outcome for you as a pair, as a family. Diseases are family diseases. They require family recovery.
A joint journey. I like this, where there's support all around. The chance for success is on your side. This is so valuable.
The other thing that's a joint journey is the person who has surgery has to realize that the people in their lives are going through changes too. As the weight loss person goes through changes, the people in their lives are having a different experience, and their journeys are changing too. So it's not just about me. How is this affecting you, honey? How is this affecting you, daughter? How is this affecting you, my good friend?
Ooh, this is really valuable, which makes me, as we wrap up, I have one last thought I want to tie into this. So some of our listeners may be having relationship issues right now, and they're going, yes, my family's changing, my friends are changing. What can they do?
Well, I just did a webinar about relationships, and if anybody's interested, they can email me at cstapletonphd@gmail.com, and I'll send them the video from that talk, or I can send you a link to it, and you can put it on your Facebook page.
I'll be glad to put it in our show notes. I'll be glad to share that, most definitely.
That's awesome.
This is very good information. As always, Dr. Connie, thank you so much. I appreciate that you will take a deep dive into these topics and talk about things that are hard, because the information is so helpful. Thank you.
Thank you for bringing these topics to your listenership and the people in your group, because everybody goes through these things. I appreciate you so much, Dr. Susan.
You are welcome, and it is my pleasure. So remember, a joint journey, this is what you are aiming for, that support all around, so that the chance for success is on your side. Because remember, you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions, which do not necessarily reflect or agree with the host, Dr. Susan Mitchell, or Practicalories, LLC.